So that's basically the main screen of the simulator software. And here in part, I've got the PowerPoint presentation. I don't know if you have a look at it, but basically this is going to be for you, for the participant. That and in parallel your assistant will use this Muse software, probably on option, so you can both have the screen on at all times. So probably requires two laptops. So this is for you, and this is for the assistant, and you have the protocol together. Basically, it's going to follow your actions. So maybe we go over the PowerPoint, and then I'll make the inputs in the Muse software in real time. So this is the main steps of the protocol. So basically, you start with a checklist. Let's just start. Basically, when you actually launch the presentation, it's full of links. You know, you can just back to top, next step. See, it's just interactive, and I think I like it. I think it's useful. You're gonna have to check if you have all the different equipments in terms of oxygen delivery, suction system. These are more theoretical, because obviously you're not gonna have an oxygen bottle or a specific operating light, but I thought it would be more it would be relevant to put it in the checklist, because it's in real life situation you would have to check for them. Then the monitoring and basically all the anesthesia equipment, so the airway, face mask, IV access, laryngoscope, tube, stuff like that. The drugs, I think, what I recommend is to prepare four syringes beforehand. So one is going to be atropine, midazolam, ketamine, and rocuronium. So 2, 5, 10, and 20 milliliter syringe, one of each size. So these are the 4 sizes that will be available on site. Yeah. Even the laryngoscope, I put my hands on an old one. Yeah. So I'll leave it there. This is basically just the checklist. You make sure you have all the syringes ready, and then you start with the. So that's going to be IV line placement. You'll have catheters. Obviously, there's no arm or a real patient over, so maybe you just skip this step. Yeah. I'm just gonna pretend to do it. I don't know, in the air, or just gonna attach it to the table, or yeah. So then what you do is you place the monitoring equipment, and then you start giving the patient oxygen. So this is a really simplified protocol in which you don't even have the choice between general anesthesia with or without intubation. You know, I just deleted the spontaneous ventilation one, so it's really straightforward for you. In the original PowerPoint, you had to choose between either with or without intubation. So it advises you to give oxygen. So if we go to the Muse software, what you do here, you apply the non-rebreather mask, put the max FiO2 available, and then because it's just 70% here, I don't know, for some reason you don't have 100% with a non-rebreather mask. I guess that's in real situation you don't reach 100%. The FiO2 to 100%. I've got the link here. If you don't have it in the list, you just click on intervention, Gen 2, and 100%, and it just leads to the same result. It's pre-oxygenating. Okay, so at least for 3 minutes. There's another step that we didn't put, but it's in the Word document, is the blood loss, because in the schematic to give some blood loss to the patient to simulate, you know, like a severe situation. So click here on the blood drop, and here on. Well, I suggest you give 1 liter. You see the blood pressure will drop really bad, and it's gonna start beeping, and years. So can hear it. So if you go to the Word document with all the different steps, I advise to give some IV fluids, obviously, in this situation. So that's what we're gonna do. If you go to crystalloids, so this is when the simulation starts. The patient comes in, has a broken limb, lost blood, about a liter, and because of the deconditioning, because of the settings of the specific model I input in the software, the hemodynamic tolerance is really bad. Blood pressure is so low. If it was healthy, it would have been just fine, but that's not the case. So that's giving crystalloids. Suggest 1 liter. And see what happens. Usually it gives a good. Blood pressure is better. So we gave oxygen, we gave IV fluids, and then we're just going to start with the induction of general anesthesia. With atropine, so yeah, all these are. This is the general anesthesia protocol that I recommend, and that's been published previously. So that's just what I'm following. So start with atropine, the benzodiazepine. It's still receiving oxygen, and we start with the ketamine, so 2 milligrams per kilogram. And then the muscle blocker. So on the Muse software, but in parallel, you're gonna have to inject it to the mannequin, or to pretend to inject it to the mannequin using the 4 syringes that you had ready. So hemodynamic response to the induction of general anesthesia so far is good, because pressure didn't drop. If we'd done it with propofol or thiopental, the blood pressure would have dropped drastically. So that's the interesting part with using ketamine. So as you see now, the response rate now fell to 0, because obviously I injected muscle blockers, and so now is not breathing anymore. So after you the muscle blocker, you need to wait for 1 minute. So that's the recommended time you need to wait for before intubating. So then I'm just gonna put it in full screen here. So this is the most detailed video about retracted intubation, because I think it's not. So I'm just gonna mute it. It's not straightforward when you've never done it. So I put a little bit a lengthier video here to give really good instructions. I think this video is really good. So this is how to intubate, and then what it gives you here the ventilation settings. Okay, so going back to the software here, what you need to do, so is not so far not desaturating because of the oxygen we gave him. So what you need to do here to simulate the mechanical ventilation, you click on the lung here. You see here respiratory rate is modeled, so we're going to override this and put 15. So that's the respiratory rate. Okay, and the tidal volume is modeled as well. So we're doing the same with putting 500 milliliters. Okay. Oh, sorry, I forgot to intubate. Sorry. Here, you need to intubate first. So you click on intubated, 100% oxygen. Now you'll see that the respiratory rate is gonna go to 15. Saturation is not gonna drop. Blood pressure is good. Heart rate stable. So basically now the patient is anesthetized, intubated, and ventilated. So he's ready for the surgery. If we go back to the port, so now it's going to be the time of the surgical procedure. So other stuff you can inject to the patient. I'm not sure it's going to be necessary. Probably not, because there's no link between the mannequin, the surgical field, and the software. But if for example you want to simulate another additional blood loss, that's always possible. You know, you just go to the new software, click on the blood drop, and you can add any one. So let's see what happens if we add half a liter. Let's see how the blood pressure reacts. So the plan is to compensate blood loss with crystalloids, because that's the only probably the only IV fluid that's going to be available. And I suggest twice the volume, once or twice the volume. So see, the blood pressure is dropping. It's not too bad. I'm just gonna give crystalloids. So that's just an example of what you can further do. In real life, if the surgical procedure would a little bit long, we would have to re-inject ketamine, maybe even muscle blocker. Okay. So at the end of the surgical procedure, what's recommended in real life is to inject an antagonist of this rocuronium that we injected. So Sugammadex is the drug. We don't have it in the software, because it's a new drug. So what we can do instead is to the NMB, which is neuromuscular block, 100%, because we just injected a muscle blocker. So if we put it back to 0, news ventilation is going to resume, and basically the patient is ready to be extubated. That's obviously something you need to check before removing the tube, that the patient is breathing and conscious. So this is what I recommend doing at the end of the surgical procedure to reverse the muscular blockade. back to the PowerPoint. So you wait for the return to consciousness. Nothing more to do than wait. You need to check that the patient is breathing, that he's got his airway and larynx protection reflexes, and then you go to the next step, which is extubation. So on the mannequin, you can just remove the tube, the cuff, obviously, before removing the tube, and then after extubation, apply oxygen using just a face mask. And then basically that's it. You go to the postoperative phase, where you just need to obviously keep checking the vital signs. I recommend writing them down. You give painkillers if necessary. And that's the end of the procedure. There's nothing else to do, nothing else required. Basically now is, I guess if I go back to the modeled to rate and modeled tidal volume, my guess is that is going to breathe. See. Oh yeah. So it looks fine. You see the respiratory is stable. Patient is just fine, and he's been successfully operated on Mars.